talocrural distraction, okay, which is good for everything. Okay, so when you're doing the distraction this way, again, the distraction is going to go to the knee and the hip, depending on how much you do. You're going to hold your head?
You want?
That's the rack. That's the rack distraction. Okay, so what you want to do, there are many different ways to do this type of distraction. One way is to take the ulnar border of one hand and just put it around the medial foot with the ulnar border just distal to the malleoli, and your thumb is on the plantar surface, and then the other hand just over the over your first hand, but on the lateral surface. So kind of your thumbs are like this in the middle of the plantar surface of the foot, and then you lean back. Okay, and you can have the person in their neutral position, or you can take them up into more dorsiflexion, and you lean back. You all right there? Okay, so that you're getting a distraction right at the talocrural joint. Okay, you can do this distraction in any amount of plantar flexion. You can do it in dorsiflexion. You can. There's not much of inversion or eversion at the talocrural joint, but there is a little bit. So you can kind of put the foot in a little bit of inversion and pull. Or you can put the foot in a little bit of eversion and pull. Okay. So there's one contact. Some people will use a different contact where they'll hold the calcaneus and the talus from the posterior surface, and then the dorsum of the foot with the other hand, and lean back. And you can do the same thing in more dorsiflexion, more plantar flexion, teeny bit of inversion, or teeny bit of eversion. Okay? So that's one way. Two hand holds, the person's supine. If there's no complication, if there's no contraindication or precaution for the knee or the ankle, the knee or the hip or lumbar spine, come onto your stomach. This is a very, come a little closer to me. Okay, this is a very cool way to do a distraction, which doesn't require much pulling on your part, and it's not going through the knee or the hip. Okay, so what you do is take one hand around the as proximal on the calcaneus as you can get, the other hand posteriorly, the other hand over the dorsum of the foot, so you're on the talus. Fingers are on the medial and lateral foot, and then what you do is you bend their knees. So they have to have some rectus flexibility, and then you keep this hand, the hand that's stabilizing, steady. So you're not going to dig into the hamstrings, and then you try and bend some more, and that creates a really nice distraction. So what I'm doing is I'm actually pulling up that way. So it's kind of like an Apley's, but with a little bit more leverage. Okay. Which way did you feel? Did you ascertain any difference between this and with your supine?
I feel a little better.
You like the
I
other
feel
one?
my legs coming up too.
What?
I feel like my legs coming
Legs
up.
coming up? Okay, so, this is limited by how much knee flexion they have and how much rectus they have. Okay? So, let your foot come down. Okay. Now, we're going to drop down to the subtalar joint. And there's also a distraction at the subtalar joint. So, you can do this same type of distraction, only what you're gonna do this time is come as, distal on the calcaneus as you can, but on the calcaneal bone, not around the fat pad. Okay, so you're not gonna be holding here, you're gonna be holding around the calcaneus, and, then on the dorsum of the foot, you're gonna come so that you're a little bit inferior to the talus. You're gonna be more on calcaneus, on cuboid and navicular with your hands, okay? And then you can do the same thing, like this, and now you're still getting talocrural, but you're also getting some subtalar, okay? So that's just moving distally by one segment. Come onto your back. Okay, and then the same idea is moving distally by one segment. So you're gonna hold as distal on the calcaneus as you can, and then over at least the distal part of the talus, and you pull back. And again, with this one, you can bring them into supination and distract. You can bring them into some pronation and distract. So you can't really use this handhold very well at all, because you want to really be on the calcaneus. Okay, so that is subtalar, and there's not going to be a lot of distraction there, but whatever you can get, it's better than nothing. A subtalar distraction straight, or with some plantar with some supination, with some pronation. Okay. Staying at the subtalar joint, what we're gonna do is you can't really do any kind of effective APs and PAs on the subtalar joint itself. So what we're gonna do is we're going to move into the physiological movement of supination or pronation. So the subtalar joint, some people call it a talar rock, some people call it a talar twist, but basically what you're doing is you're trying to stabilize, you're gonna stabilize the distal tib and fib, and you're going to try and take a hold of the talus and twist it into supination, twist it into pronation. So remember, when you're twisting into supination, you're trying to get some, what's supination? Plantar flexion, adduction, internal rotation, okay? Or inversion, yeah. And then into pronation, you're trying to get some dorsiflexion, so you're imagining that, dorsiflexion, eversion, and abduction, okay? So if you can stand on either end, you're gonna stabilize the distal tib and fib, and you're gonna take a hold of the talus from the top, okay, from the dorsum. So you're over the neck and the dome thing, and then you're gonna try and pull up into supination, and then down into up, twist it towards supination and towards pronation. Supination, pronation. Okay. Let me get rid of this side, rid of this side. Okay, so you're gonna hold at the talus, at the distal tib fib. Take a hold around the talus and do a twist towards supination and twist towards pronation. Okay? So that's relatively simple to do. Now, obviously, if you have somebody who's an overpronator, they have a lot of pronation, then you're gonna twist towards supination. And don't try and increase pronation, because they got enough of it, or vice versa, okay? So, you have the distractions, at the talocrural joint and at the subtalar joint, using the prone technique, using the supine technique, different handholds in straight, in neutral, in pronation, supination. Okay, you all practice.